So hello and welcome to your first day of residency here at Gallows Memorial Hospital. My name is Dr. Klazowski, but everyone here calls me Dr. K. Today you'll be getting a tour of the hospital, getting assigned a second-year resident, learning some hospital protocol, meeting some patients, and learning all about their cases. And I'm sure the hospital will feel like home to you in no time. But before we start, I'd like you to please shut off your cell phones. As most of you should know, cell phones mess with our equipment. Thank you. Now, since we're in the lobby, I'd like to start our tour in the waiting room. We like to make people feel as though they can trust us with their loved ones. Take this woman here, for example. Look at her. She looks terrible. She's an ugly crier. And the worst part about being an ugly crier is being an ugly crier in public. What we do as doctors is try to make people feel better. So, ma'am, why are you crying? And what can I do to help you or a loved one today?
My husband just died!
Oh. Well, I guess there's nothing more we can really do. Have a great rest of your day, ma'am. To the ER.
Back in my day, this hospital used to be much cooler. There was also a much larger janitorial staff. Now it's just me and these two young guys. You'd think it needs to be a little fun, but no. They're like fucking priests. One of them caught me with a joint and reported me. Can you believe that? My boss let me off with a warning. He said if I ever do it again, I get fired. I just wonder what they all think if I told them I still do over half the nursing staff. Not to mention a handful of surgeons, and some patients too. Maybe if they paid me a little better, I wouldn't have to seek some extra compensation. You know, all you interns always think you have the worst jobs. You complain about the long hours that you get stuck doing gross jobs. Well, let me tell you about gross jobs. I have to clean up all the vomit and shit that these patients spew out. You won't believe the disgusting amount of guts I have to
Okay,
eat.
I think that's enough gender buck. I think they need you in the morgue.
Oh, good. That usually means pause.
Okay, let's continue our tour. Let's try to find Jake in the ER.
Before it goes, anyone want to buy any wheat?
Now.
Hey, my name is Jake. I'll be your doctor today. What seems to be bothering you, ma'am?
My elbow hurts when I do this. Is that normal?
This is the shit you deal with while working in the ER. The other day, I had this guy come in who told me that his ear hurt when he put his finger in it. So he shows me. The idiot puts his finger in his ear so deep that I swear it almost went up to his nose. Turns out, he was tripping on acid and wanted to scratch his brain. That's not even the worst one. I had this woman come in who told me she was having serious nose pains. I checked her medical records, and she turns out to be another junkie, looking for a prescription of pain meds to get her fixed for the weekend. It's people like that that make it hard for people who are actually in pain to get their meds. Today I'm stuck with this moron. May I ask why you're doing that with your arm?
Because I want to.
Well,
Can't I move my arm in any way I choose?
Yes, but if it hurts, then why are you moving your arm like that?
Because I want to.
Well, what would you like me to do for your elbow?
I want to make it not hurt when I do this.
I prescribe stretching your arm. Have a fan-frickin-tastic day.
What kind of stretching?
Look it up on WebMD.
Today, I'm going to give my dad a kidney. Now, people tell me how brave I am for doing this and how nice it is that I'm doing this for him, but the thing is that he doesn't deserve it. Now, don't get me wrong, I'm not some pain-in-the-ass selfish kid who doesn't want to give his dad a kidney because, I don't know, maybe Megan Fox needs one first. He just doesn't deserve it. Now, here's what happened. I was outside raking the leaves, and he just comes outside and starts yelling a bunch of incoherent things. See, he does drugs. Crack, heroin, hell, maybe even meth. I don't know, I try not to pay too much attention to it. Anyway, he comes outside and yells, "Where's the waffle maker?" Like I'm supposed to know where the waffle maker is. So I yell back, "Go inside and I'll make you some breakfast." And you know what he does? He throws a flower pot at my head and it hits me. It hurts like hell, but I haven't thought about it at all because I can't stop thinking about my dad. After he hit me with the flower pot, I went nuts and I tackled him, and you know what he does? He just passes out. That's it. He just passes out, and it was so anticlimactic. The one chance that I had to stand up to my dad and his abuse, he just doesn't even fight back. So I'm sitting there with my head bleeding. He's out cold, and my mom's crying and calling the ambulance. It's a fucking shit show. When I got to the hospital, it turns out that the drugs killed my dad's kidneys, but lucky for me because I'm a match. The thing is, I don't want to give him my kidney because, well, he's a dick, okay? He's a dick. He can fucking suffer. I'm not going to give him my kidney. I will not give him my kidney. I'm so out of here. I'm going to put some pants on first, and then I'm so out of here.
Hey, Alicia, have you met our new residents yet? I thought you'd be the perfect person to give them a tour of the hospital. Well, I spent some time with the new nurses.
Oh, not a problem, Dr. K.
That's my girl. Stiggle.
Let me give you a quick rundown of Dr. K, or Dr. Douchebag, as us nurses like to call him. He hits on every woman he sees. He even goes after widows, and I mean like right after their husbands are pronounced dead. He just swoops in, calls it his personal touch. But really, it's just a way for him to offer a shoulder to cry on. I did some digging, and turns out he's not even a real doctor. He didn't even pass his boards. He's still on staff here because his daddy owns the hospital. Basically means he's their spokesperson. And of course, his face is on all of our merchandise. I thought it was funny, at first, that he only ever hangs out in the waiting room and never speaks to a single patient, but now I know the truth. The other nurses and I put up with all the ass grabs, inappropriate flirting for, get this, job security. Every time the hospital's having money problems, they cut the nursing staff. And if Dr. Douche likes you, he won't let his daddy fire you. I've got a 7-year-old at home who wants to play soccer this year. I can't lose my job.
Hello, my name is Jake. I'll be your doctor today. What's your problem, sir?
What?
Why are you here?
Don't yell at me!
I'm not. Just tell me what's bothering you.
My psychic told me that I'm going to die.
Sir, I don't know how to tell you this, but everybody dies.
Oh, I know that. But my psychic told me that I'm going to die soon.
Well, is there anything wrong with you, medically speaking?
Well, I've got, arthritis,
Okay.
angina, diabetes, and,
blood sugar looks normal. Are you having a gout flare-up?
No, of course not.
Well, then I'm sorry, but you're fine.
Marty! Marty! Are you dead yet?
No, this doctor says I'm
Oh,
fine.
what Madame Celeste said.
I know what Madame Celeste
Well, then
said.
why are you saying that you're fine?
Because this quack doctor says I'm fine.
Why would you say that?
Let me see if I can figure this out for you. Is Madame Celeste part of the psychic network?
Yes.
Ooh, okay, all right. And when you called her on the phone, did she ask your age?
Yes.
And you are 89 years old.
Yes.
So, I think she assumed, because of your age, that saying you're going to die soon would be a safe bet.
Are you a psychic too?
Fuck this shit! I know. I should respect my elders and blah, blah, blah. But when old people come in, it is always the end of the world. And 9 times out of 10, they're perfectly fucking fine. No, I think they just want the attention. The problem is, their dumbass families ship them off to condos and never visit. The two of them have probably been driving each other crazy for about 50 years. So they do dumb shit, like call the psychic network, just so they have someone to talk to besides each other. I swear, if like the littlest thing happens, like a tiny cut or a stomach ache, then they have to rush to the hospital. Oh, now, because they are in the hospital, the whole fucking family has to come and pretend that they don't ignore them until a holiday or a birthday. You know what is the worst part about dealing with crazy patients? When you can actually rationalize their situation. You know, I don't tell my patients this, but yes, I am a psychic.
I knew it! Well, my mom will become cancerous, in the future.
I'm gonna throw up.
Why would you do that? You haven't been that rough with me since our honeymoon.
Oh no.